If I could tell applicants anything about this program, it would be that 3 years into it, I am so glad that I matched here.
I was made to feel welcome here. I was made to feel like I belonged and that my education would be very highly prioritized above anything else. And it just felt like home.
I think what first attracted me to the city of Omaha was it was kind of the perfect size that I was looking for. Not too big, but not too small. It's kind of a small town feel with the big city amenities.
Omaha has been such a blessing to me and my family, and coming from out of state, I didn't know that it would be, and I would choose it over and over again because of the community and the wellness and the support that you get here.
I was very excited to see all the different things I could do here, whether it's go to concerts, Broadways, all different kinds of restaurants, and there's always something to do every weekend.
I think a typical Creighton resident embodies the Jesuit ideas of cure personalis, mind, body, spirit. So the typical Creighton resident is academically inclined and certainly here to learn to be the best psychiatrist possible, but also understands that that does not just mean burying your head in a textbook. It means caring for your body while you're here, caring for your mind, and also making sure that you're taking care of your spirit and not becoming too burned out during residency, because we're at our most successful caring for patients when we have gas in our own tank. And I think that our program really gets that, really promotes that.
I have an orthopedic surgery resident husband and one child on the way, and I'm able to give 100% of myself to my family and 100% of myself to my work. And that's a total credit to the opportunity that Creighton gives its residents to breathe and have reasonable work hours and have the support that they need.
Even with Step 3 studying, I feel like I've been able to go out on the weekends, have fun with friends, spend time on my own to relax as well. I feel like the work-life balance at Creighton is very ideal.
Creighton helps prepare me for the infamous psychiatry boards in many ways. It's definitely not something that the program makes you think about every second, which is good, but it's built into our everyday learning, which I think is the best way to prepare. When I see a question on the PRIDE exam, I think, I've had a conversation about a certain patient and a certain diagnosis with an attending, so I remember the answer to this question.
We're also given multiple different resources online that we can utilize. We're also given help finding resources of our own, whether it's Q banks or textbooks that we can kind of tailor to how we study best.
We also have academic half-days as part of our third-year outpatient rotation.
When we have our protected didactic time, it is truly protected, At 11:30 on Wednesday, your clinical responsibilities are finished for the day and you get to go learn. And there's nothing in your way. You're not finishing notes, you're not fielding pages. You are truly off from 11:30 on Wednesdays.
My upper-level residents and faculty members are fantastic mentors. That is one of the strengths of the Creighton program.
The upper-level classmen and the program administration help us by really going out of their way to make sure that we're doing okay even from the beginning. Dr.
Malin, for example, comes to mind. It's just like watching orchestra conductor conduct a symphony so gracefully, and it's so difficult, but she does it so well, and she makes everybody feel welcome.
The program director meets with the first-year residents once every few weeks, and we can talk to her basically about anything.
They make you feel valued as a resident, not just part of a machine. So if you come to them with something, they will invest significant amount of time to make sure that your concern is resolved or your question is answered.
Also, time management, our faculty really kind of help us to model. How do you prioritize certain things at certain times of day, and how do you find time to see all those patients in a day, complete all that documentation, and then also have time to really deliberately prioritize teaching.
The most exciting thing about the psychiatry program, in my opinion, is that it's constantly evolving for the better.
I do feel like we're really well taken care of here. They really listen to us and they'll make changes based on our feedback very quickly.
If there's an aspect of the program that we feel like is lacking, it shows up the next year. If we need forensics, we add the rotation. And so we have a variety of clinical sites, which not every program has. And if you want something, the program will change for the better, and pretty quickly too.
I think that's something that's pretty unique about Creighton.
I think the thing to know if you are looking at doing your residency here at Creighton is that your learning is the top priority. Education is always number one. It comes before everything else. They've taught me patient care. They've taught me how to teach. And I have felt really, really well supported every step of the way.
I feel like when I'm done with this program, I'm going to be fully ready to be the best attending I can be.